want to welcome everyone. I want to extend my welcome, that will be done officially by President Designate Jr., but let me extend welcome to those who are here with us this evening to join us for another meeting of the Kiwanis Club of Kingston. And this evening we will have Dr. Roger Hunter, consultant neurosurgeon, with us talking about all you ever want to know about strokes, which is a very important topic as we try to preserve our health and longevity. So we're looking forward to a great presentation from our guest speaker, Dr. Hunter. But before Dr. Hunter comes on, there are certain preliminaries that we will do. So I'm going to ask President Designate Jr. to do the official welcome to everyone here this evening. President Designate Jr., over to you.
I'm President Paul, and good evening. Thank you, President Paul, and good evening to all our Kiwanians and friends online. Tonight, as we have said before, a very intelligent topic, a very interesting topic tonight. Dr. Hunter will be telling us all we want to know about stroke. Just before we get into that though, I'll just give the Kiwanis Club an opportunity to bring greetings at this time. We will start with those clubs outside of Jamaica. Those clubs outside of Jamaica that would like to bring greetings at this time.
Good evening. I'm visiting from the Kiwanis Club of Bridgetown, Barbados. And my name is Nancy Phillips, and I'm delivering greetings on behalf of the president and members of the Kiwanis Club of Bridgetown. It's a pleasure to be here. And I pray God's blessings on the meeting and on all of you.
Thank you for coming. Any other clubs from outside of Jamaica that would like to bring greetings?
Good evening. Good evening, all.
Good evening.
I am Mary Walcott from the Kiwanis Club Pride of Barbados. Happy to be here. I'm bringing greetings on behalf of President Paula Ann and members of my club, and I wish you a wonderful evening. Thank you.
Yes, thank you too, and thank you for coming.
You're welcome.
Good. Any other clubs outside of Jamaica that would like to bring greetings? If not, go on, go ahead, sorry.
This is Kim Marlene from Kiwanis Club of Barbados North, bringing greetings on behalf of our president, Eric.
Thank you.
Welcome.
All these greetings coming from Barbados. Any other? If not, we'll move inside of Jamaica and we'll start with Division 25. Any club from Division 25 that would like to bring greetings at this time? Division 25.
Good evening, fellow Kiwanians and guests. This is DLD Joe from the Kiwanis Club of Hopewell. I'm seeing one other member so far, Kiwanian Monique. I'm hoping that others will join.
Yes.
Looking forward to a very informative meeting. And at my age, strokes is very important to me, and that's why I'm here. Thank you very much.
And thank you for coming.
Good.
Thank you, DLG. Any other club, Division 25?
Good evening.
Good evening.
I bring you greetings from the Kiwanis Club of Outermany, Western Jamaica. President, on behalf of President Kingsley and the membership there. I am DP Denzel, and with me, there are about 4 other members. Looking forward to a great evening with you.
Okay. Thank you, DP Denzel. Thank you. Any other club? 25, Division 25. Division 25. If not, we'll move to Division 24. Division 24. Division 24. If not, we'll move to Division 23 and we start with 23 East.
Good evening, everyone. I am PD Mark from Kiwanis Club of Cyber Connect, bringing you greetings on behalf of President Narisha. We're looking forward to this wonderful topic you're presenting.
Right.
And we have 3 members online.
Thank you for coming, PD Mark. Thank you. Division
Good evening.
3 East.
Yes.
Go ahead.
Evening. Right. This is DS Linda from Kiwanis Club of New Kingston, representing President Janelle and the club. At the moment, we have 3 persons representing. Thanks for inviting us, and we are hoping for a wonderful meeting tonight. Thank
Good.
you.
Thank you for coming as well.
You're welcome.
Right. Division 23 East.
Good evening, Kiwanians and guests, PD Juna. It is good to be on with you. As Joe said, stroke is in our age group, so I'm sure it can
we are of the age.
Yes. I bring you greetings from the Kiwanis Club of New Kingston. At the moment is Jackie Maylard and I are on, and I know others will be joining soon. So have a great, interesting and informative meeting. Thank you very much.
And thank you for coming, DLG Gertlin.
My pleasure.
Always welcome you.
Thank you.
Good. 23 East. 23 West. 23 West. 23 West. If not, we move to our own division, 23 Central. Those come from 23 Central that would like to bring greetings at this time, please do so.
Hello, good evening, everyone.
Good evening.
This is President Achille from the Kiwanis Club of Nation Builders, Kingston. I am joined with 2 of my directors, Director Nikita and Director Tiandra. We look forward to this meeting, especially since one of our members recently had a family member who suffered from a stroke.
Okay. Thank you for coming.
Thank you.
Good.
Hey, good evening, PE Junior. How are you doing?
Hi. Hi.
Oh, okay. Well,
Yes.
as you know, I'm PED Eurydice from the Kiwanis Club of 23 Central, Surrey Online.
Right.
And this evening we have a delegation of 4, a growing delegation, I might add.
Yeah.
And one member of the delegation is our newest member, Shana K. Williams.
That's good.
Yes, so we're so excited for her to join and to be in the meeting this evening. So thank you for inviting us, and we look forward to a very informative and exciting meeting. Thank you so much.
And thank you for coming as usual.
Bye-bye.
All right. 23 Central.
Good evening, everybody. President Stacy here from St. Thomas. I have 1 member with me, and I do wish you a smooth meeting tonight. Thank you for having us.
And we do thank you for coming as well.
Good evening, President P.E. Juno. President
Right.
Cheryl is also online from 23 CSO.
Okay.
Thank you.
Thank you for coming. 23 Central. 23 Central. If not, what about our SLPs? Do come on and bring your greetings now at this time. SLPs. Yes? Are there any other viewers that would like to bring greeting on this time? Any other Kiwanian, non-Kiwanian that would like to bring greeting at this time?
Hello, good evening. I am President Audrey from the Kiwanis Club of Papina Chitec, Division 23 East.
Okay.
I'm alone. I'm the only person here at the moment, but other members of my club will join shortly. Wish you a successful meeting.
I am sure. Thank you for coming. Any other?
Good evening, everyone.
Yes.
I am DP Jennifer from the Kiwanis Club of Greater Portmore.
Good.
I see 3 other members on.
Good.
We're hoping to enjoy your meeting and hope other members will join soon.
All right. And a very good evening to you, and thank you for coming as usual.
You're welcome.
Yes, go ahead.
This is Director Roy from the Kiwanis Club of Toronto Caribbean. Just bringing warm greetings on behalf of President Sharon and the members of the club. And we wish for you a successful meeting. I'm not sure how many members are on at this moment.
Right. Thank you very much for coming all the way from Toronto. Okay. I'm sure you'll enjoy this meeting. Thank you again.
You're welcome.
Sonia?
Good evening, everyone.
Yes.
This is Sonia from the Kiwanis Club of New Falmouth.
Okay.
Bringing sincere greetings on behalf of President Roger and the general membership.
Okay.
So far, I am seeing 3 of us, and I think that others will join. Looking forward to a very informative, enjoyable meeting.
Okay, and thank you for coming again.
My pleasure.
Good. Any other? If not, I'll just pass back to President Paul. President Paul, however, look like it will be a long program tonight.
Thank you very much, President Designate Junior, for doing the welcome. And I want to give my welcome as well to the 123 participants that we have online as well so far. I'll move on to the apologies of absence. I have 2 apologies. Our Director Warren McDonald sent a note that you'll be a bit late, and our Sergeant at Arms this evening, Kiwanian Zuri, has work commitments, so he will not be able to join us as well. Did you receive any other apologies, Secretary DOJ Willie?
Sorry, I was muted. Apologies from DLGE, Trevor Christian, and Treasurer Orville.
Okay, thank you very much for those 2 apologies noted. We'll move on to the recognition of birthdays and anniversaries, and we have to do that. We'll have President-elect Designate Newton, PED Newton.
Thank you, President Paul. Good evening, fellow Kiwanians, friends on the platform. This evening is really a heavy weight. And I can tell by the fact that there's 130 of us online already. So let me get right into it. The birthdays from the Kiwanis Club of Kingston for this week, we start off with DP Gian Demel, who celebrates his birthday on the 7th. Also celebrating on the 7th is the major one, and that's DP Major Richard Reese. He also celebrates his birthday on the 7th. And on the 10th of July, I have the man that I personally call Superman. He's the one who is responsible for all of these meetings being what they are every single week, and that's DP Stuart Spencer. His birthday is on the 10th of July. Having gone through the birthdays, let's look at, we have 2 anniversaries. There's DS Jeffrey Madden and Carol, who celebrate their wedding anniversary on the 8th. And there's also Kiwanian Anthony Harris and Leonie, who celebrate theirs on the 9th. That being said, I'm going to invite through President Paul, anyone who is on the platform who has any special occasion, this week, last week, the week coming, just open up your microphone and let us know so we can celebrate with you. Anyone?
Carl and I celebrated 56 years of marriage.
56 years of being in Kiwanis.
No, of marriage, natural marriage.
Okay, congratulations. Right. Anybody else? No? All right. Well, that being said, I am going to presumptuous President Paul and just say big up to Dr. Hunter, who is with us this evening. I know he's going to be talking about strokes, but I saw where recently he is the brain behind the first awake brain surgery in Jamaica. So I just want to say big up. I understand why we now have 134 persons online, and it's back to you, President Paul.
Yes, thank you very much, President-elect Designate Newton, for doing recognition of birthdays. I will move on to the segment of Kiwanis education, and I'm going to call on LGED Desmond to do so.
Thank you, President Paul. Good evening, everyone. My topic is how to present motions using Robert's Rules of Order. 1, we wait until the last speaker has finished. Next, rise and address the chair by saying, Mr. or Madam Chairman or President. Wait until you are recognized. If it is one of those motions where the current speaker cannot be interrupted, then speak in a clear and concise manner, stating the motion in the affirmative. If you want to cancel a previous action and bring it again before the assembly, after recognition by the chair, you say, I move that we rescind the previous decision to, and you state it precisely. It requires a seconder. It is debatable, may be amended, and it requires 2/3 or majority vote with prior notice for approval. If the chairman is not following the order of the approved agenda, without recognition by the chair, you call for orders of the day for him or her to adhere to the agenda. Or you can say, I rise to a point of order, or simply, point of order, as a deviation is an infraction of the Assembly's own rule. Any deviation from the agenda after it has been adopted by the Assembly at the outset of the meeting may necessitate suspending the rules. This requires a seconder. It is not debatable nor amendable. But after recognition by the chair, you say, Mr. or Madam Chair, I move to suspend the rules and move, for example, item 7 to item 3. But 2/3 of the members present and voting is needed to pass the motion. Be courteous. Avoid personalities and stay on the subject. Wait for someone to second your motion, because if there's no second to the motion, it is lost. It fails. If there's a seconder, the chairman will say, it has been moved and seconded, and that he'll state the motion here, thus placing it before the assembly for consideration and action. The member may either debate your motion, members may either debate your motion if it is debatable, or may vote directly on the motion. Once the motion is presented to the assembly, it becomes assembly property. and it cannot be changed by the mover without the consent of the members. The mover is always allowed to speak first and may speak again only after other speakers are finished, unless requested by the chairman to speak. The chairman now asks, are you ready to vote on the question or the motion? If there's no further discussion or debate, a vote is taken. Finally, voting on the motion may either be by general consent, where it is not likely to be opposed. The chairman says, if there's no objection, he or she repeats the motion. In this case, silent is consent to the motion. But if one person objects, the motion must be put to a vote. Just to say that voting may also be done by voice, roll call, by division, or by ballot. Thank you, President. That's it for Kiwanis Education.
Yes, thank you very much, LGED Desmond, for sharing that important segment with us. And I know that that's one segment that's one education that we can also apply outside of Kiwanis. So thank you very much for bringing that across this evening. We'll move on to the introduction of our guest speaker, since most of us are here waiting to hear Dr. Hunter's delivery. So before he comes on, I'm going to ask DP Stewart to introduce Dr. Hunter to us. DP Stewart.
Yes, thank you. Thank you, President Paul. I had everything queued up and I now have to do it again. Anyway, no problem. Yeah, fellow Kiwanians and guests, it is my pleasure this evening to introduce our guest speaker. Mr. Roger Hunter is an award-winning consultant, neurological and spinal surgeon, and one of the few fellows in Jamaica of the eminent Royal College of Surgeons of England. He's an internationally accomplished neurological surgeon who worked in senior roles at the Southampton University Hospital NHS Trust, UK, where he helped to form the Unified South Surgical Spinal Service, helping to bring together hard-nosed orthopedic and neurological surgeons, each with incredibly strong personalities. He was subsequently recruited to Barts and the London NHS Trust in London, where he helped to establish the London Trauma Network, working with a team of trauma surgeons, which became a leading blueprint for the management of major trauma for the wider UK. Mr. Hunter was also, I'm trying to scroll. All right, never mind. Let me use something else. Yes. Yeah, Mr. Hunter was also a link neurosurgeon for the hyperacute stroke unit at the Royal London, UK, and helped to raise over £20,000 for various social and charitable organizations, such as the Royal London Hospital and Headway East London, which is a charity. Mr. Hunter helped to eradicate neurovascular disparity in East London by strident advocacy that resulted in a formal investigation by NHS London of the Barts and London NHS Trust neurovascular services. And this culminated in the doubling of neurovascular interventional capacity in East London and subsequently saving countless lives. The trust was subsequently extinguished and reconfigured as Barts Health, which in some way was an acknowledgement of serious failures. This is an achievement that Mr. Hunter is particularly proud of, together with getting a £500,000 grant for the implementation of a 3D spinal imaging platform, helping to improve accuracy and safety of spinal surgery and vastly reducing radiation exposure during complex spinal keyhole fusions. Mr. Hunter, following invitation, subsequently returned to Jamaica full-time in 2014 and helped to establish viable neurosurgical and spinal complex operative services in Kingston, Portmore, Montego Bay, and Mandeville. He also pioneered several options for residents of Jamaica and performed the first ever neurosurgical spinal operation in Portmore when he was visiting from London in 2012. Now, Mr. Hunter has been involved in so many firsts, not only in Jamaica, but overseas, that I won't tell you about anymore, except one that recently made the news. He headed a team of medical personnel to perform brain surgery on a patient while he was awake. Not a first worldwide, but a first for Jamaica. I will close by saying that Mr. Hunter is a proud JC old boy, and he is with us this evening to talk about strokes. All you ever wanted to know about strokes. Fellow Kiwanians and guests, help me to welcome Mr. Roger Hunter.
Hello, good afternoon, everyone. It's always a pleasure to be here. And thanks, Sir Stuart, for that wonderful welcome. It's always good to be amongst the fellowship within the Kiwanians and within the humanity as a whole. I suspect your numbers, your membership, your viewership is not only amongst Kiwanians tonight, it might also have non-Kiwanians. Just want to make a slight little correction in terms of the first. I think it's important to comment that what we did recently, and we're grateful that the Lena RJR Group Star found it, reached out to me to as a point of interest from their perspective. What we were recently first enabling was Axiom guided awake brain surgery. And that's a relatively new technology to Jamaica. So not awake brain surgery per se. In fact, you will be pleased to know that awake brain surgery has been around for thousands of years, over 3,000 years, originated in Africa. And in fact, is still practiced within Africa. But using technology, particularly the electromagnetic guided Axiom system, which is a very expensive system that we've fortunately been able to get here from Europe. It's a Medtronic product that we are able to apply this technology within Jamaica and to the benefit of the patient. And just for the record, that patient is doing well. He's now walking today for the first time without any implement whatsoever. And we are grateful to God for that and the amazing team that we have worked with at the Art of Surgery. So he's now walking on his own. So thanks again. I think it's important to just make that point and make mention of that. But again, it's always a pleasure being amongst the Kiwanians. Always wonderful to be amongst your membership. And I greet you well, greet everyone everywhere from within the Caribbean, outside the Caribbean, who are here watching. So we're going to talk about stroke today. I'm going to hopefully try to touch on stroke. Is a vast topic. I can't tell you how vast it is. It's a very important topic. And of course, it also emerged during COVID. And I want that to be very clear that when we leave here, we have a working understanding of stroke and what we need to do. And the first thing you need to understand that stroke is an emergency. A stroke is an emergency. Just like heart attack is an emergency, a stroke is an emergency. You must act expeditiously to arrest the stroke, prevent progression of the stroke, and initiate treatment. A lot of the times, this will inevitably mean going into a facility to get like a scan, a brain scan, particularly a CT scan, to decide if it's a bleed or if it's a blockage or infarct. It's very crucial because the treatments are totally different. How you deal with a bleed is completely opposite to how you deal with an infarct or a blockage where there is no bleeding. In fact, infarcts are the most common type of strokes, about 3/4, and those are generally dealt with by putting the patient on aspirin. But without getting further into the topic, I'd like to just share my screen. I have a presentation with about 60 slides, roughly showing my ideas about stroke that I'd like to share with you. So if I may, can
I'm
I?
just looking for your name. I should have put you on
Dr. Roger Hunter. I think I have that.
okay, that's D then. Let me find D.
Yes.
You can still share. It's open up DP still. You can share.
Lovely. Let me see.
Okay.
Where share screen. Yeah. Off share screen. Here we go. Lovely. And here we go. Share.
Good.
That.
Yes.
Lovely. All right.
We're seeing.
Thank you so much, my Kiwanian family. Stroke. All you need to know about stroke. Well, one thing for sure, just like a heart attack, one stroke can lead to another. Stroke begets stroke. You must treat this as an emergency. A stroke is an emergency. Under no circumstance must you sit quietly and not do anything. You must act immediately, because what is at stake are brain cells. Brain cells at this point cannot be replaced. They cannot be regrown. And even if you have some laboratory advances, unfortunately, it's not yet applicable to the clinical or the human experience. So once you have lost your neuron or your brain cell or your spinal cord cell, unfortunately, as it stands, that is it. There's a lot of work around stem cells, but as yet we cannot connect it up so that the stem cells grow and replace and do that exact function of that neuron that was lost. So what is the message here? Stop stroke, stop all strokes. And if you've gotten a stroke, let us stop another one from happening. A stroke is a huge burden on society, a huge burden on the patient, a huge way to suffer. It is just not a pleasant condition at all. And I, as a neurosurgeon, have seen many, many strokes, and I would not, I'll be a happy man if I don't see another one. I'll give you a typical example here. An 84-year-old female with a 2 hours history of transient weakness in the right arm and a slurred speech, right-handed person, hence the speech goes. They vomited and actually 3 days earlier had food poisoning. I must say dehydration is a factor that we have to be careful about to not miss as we move more into our, clearly summer is upon us. Slurred speech confusion was her presentation as well. She recovered within hours and unfortunately was sent home contrary to advice. She came back a few hours later with a complete paralysis. Now I hear mention one of the attractiveness to this meeting was that the perception, of course, is that given that a lot of your members are quite experienced members of society, in other words, quite senior members of society, you think this message is relevant to you. But what do you think about this 34-year-old administrator who is now left? This is someone I saw last week, Friday, with permission from the family, of course. I got her permission and she was so kind to share. 34-year-old diabetic. Look again. It's so important. Look at this. Completely paralyzed on the right side in a wheelchair and cannot speak. Again, one side paralysis, she's 34. Now, by any stretch of the imagination, we will all agree that she is not a member of the senior wing of society. She's in fact a young single mother. Strokes occur all ages, in all ages, right through. Strokes affect all ages. Yes, we do accept that as you get older, with certain chronic conditions becoming more chronic and doing more damage, that yes, you will get more and more risk for stroke, but do not fool yourself. Diabetes is Jamaica's #1 killer, and it is causing death by stroke as well in the 20-year-olds, in the teens, in the 30-year-olds. And I want each and every member of the audience to remember this. Strokes affect all ages, including the newborn baby, including the teenager, from lupus, from diabetes, including the 30, 40-year-olds, from hypertension that was not recognized, from the cholesterol that wasn't recognized. Oh, I'm young. Remember, when you tally it up, you see that quite a lot of people who died from COVID were not necessarily in the 90-year-olds. They were 30, 40-year-olds. And I'd like to just mention here that my 104-year-old nurse is now 105 who survived COVID and alive. So again, let us use this knowledge not only for necessarily to share with senior folk, but we'll share with folk of all ages, the 30-year-olds, the 40-year-olds, the 20-year-olds who have a feeling that, well, I'm going to live forever. I don't get a stroke. Sickle cell disease is common in Jamaica. That's a common cause of stroke in the young in Jamaica. A hole in the heart, fairly common as well. Congenital heart disease, cause of stroke in Jamaica. Trauma, we know trauma is ripping at the heart of fabric of society, cause of stroke in Jamaica, right? So we just want to make that clear. In terms of definition, once your brain cells not working well, whether it's permanent or temporary, we attribute, and it's related to interruption of blood supply, we accept that definition as a stroke. It can also affect the spinal cord. So a stroke is a temporary or permanent interruption of nerve cell function owing to an interruption of the blood supply. So it really surrounds the cardiovascular system, the blood circulation to the brain. That's what is affected in a stroke, as well as in a heart attack, as regards to the coronary arteries. In the case of the brain, it is the cerebral arteries that are affected. It is the leading cause of death worldwide, with the combined sphere of cardiovascular disease. In other words, if we're combined stroke with heart attacks, then we are number one. We're top of the league. And of course, there are other conditions that underpin it. This is a burdensome condition. For some of you, you may recognize what this is. This, for others, you probably have never seen it in your life. But this is what's called a bed sore. This is what will happen to you if you're on a hard surface, such as a bed, and cannot turn yourself. Stroke patients who are not able to move require constant turning every 2 hours. And I recommend that all stroke patients should have a ripple mattress, or they should have what's called an electrical or automated alternating, inflating, deflating mattress that works with an electrical current. That one is a bit more efficient than the egg crate mattress. But egg crate mattress will work in case there's a power cut, it will still work. And so this is something that you need to remember. We want to prevent this condition. We want to prevent this from happening. We must move heaven and earth. How can we classify stroke? We can classify stroke according to their timing. If a stroke occurs and within minutes, within seconds, and completely recovers within 24 hours of that event, then that's referred to as a TIA, a transient ischemic attack. A TIA is a stroke. Gentle people, a TIA is a stroke. It's not a non-stroke, it is flatly a stroke. And what is important about a TIA is that it is a warning sign. Watch out. If you're fortunate enough to survive a TIA, you can bet your bottom dollar at least 70%, 80% chance you're going to get another stroke, but one that is more permanent, one that is major, one where the symptoms last beyond 24 hours and may result in permanent loss of brain function. But a TIA is a warning sign. It's not a lucky escape. You have not escaped. It's just saying that you have recovered within 24 hours. Move quickly. That warning sign may be blindness for a few seconds, maybe weakness for a few minutes, maybe disorientation for a few seconds. Act quickly, get investigated, get onto it quickly, get that CT scan. In terms of pathological, we can look at strokes in terms of bleeding or infarcts or ischemia. So we have a type of stroke that's called hemorrhagic stroke or a bleeding stroke. This is occurring when a blood vessel has ruptured, or a weakness on the blood vessel called an aneurysm has ruptured, or another type of weakness called an AV malformation, which tend to occur in the young, that has ruptured, or something called a cavernous malformation, a cavernoma, have ruptured or dural fistula, some congenital abnormality of blood vessel. A blood vessel has ruptured. And an aneurysm is one of the most dangerous things that can rupture inside your head. And the most dangerous aneurysm perhaps is the one that is not known, because 20% of people or 30% die on the spot once it ruptures. So you really, especially if you have a family history or you've been having headaches, you should really treat it. But a hemorrhagic stroke typically occurs in hypertension and diabetes in small vessels that affect something called the basal ganglia in the brain, and deep structures in the brain that control movements. Those tiny vessels that rupture can lead to the classic dense one-side weakness, and in some cases, loss of speech. Now, the infarct or the ischemic stroke occurs when there's a blockage, and this occurs in 75%. There's a blockage, there's a blood clot that has formed within the blood vessel. Say, for instance, inside the blood vessel, it is very irregular, it's thick, it causes a thrombus, acute blood clot to occur within the blood vessel, blocking the circulation of blood. The structures beyond the blockage. So a pipe is blocked. It's not ruptured, it's just blocked. And this can occur typically in high blood pressure, in diabetes, in high cholesterol. Patients who smoke, I want to emphasize it again, smoking is one of the most preventable, reversible causes of stroke. We want to stop smoking, move heaven and earth to stop smoking. Alcohol can also cause it. Lupus, systemic lupus erythematosus, or SLE, another cause of stroke, or autoimmune conditions. We can talk about COVID, and COVID vaccines can also lead to stroke, ischemic stroke. We can also have stroke occurring from medication as well. They can also thicken the blood, like oral contraceptive hormones that can thicken the blood and cause thrombosis, and that can lead to a stroke, and other medications as well. Hormone replacement therapy, HRT, can lead to stroke. So very important that we pay attention here. Some medication that are used to thin the blood can cause hemorrhagic stroke above, such as aspirin. Now there's a type which called combined or conversion of a infarct into a bleed. That's like a combined stroke where you have both infarction and then secondary bleeding into an infarct. That one is a very major stroke as well. And we try that one, we're in a little difficult position because as well as there's a blockage of the blood vessel, the substance of the brain has no blood within the substance, and you are now, your hand is kind of tied in terms of not being able to give blood thinners. I think we can all see this here. And what this is showing is blockage, acute blockage within the blood vessel on a slide. Here it is, you see a thick wall blood vessel. And then in the middle, you see that red? Those are blood clots, the red blood cells that are clotted together and blocking the blood vessel. So this is actually a thrombus within an atheromatous plaque within a blood vessel. So blood vessels blocked by a clot inside the blood vessel. We need urgent blood thinners. Once we know that this is the basis, we need to give our aspirin quickly. We need to give our other more potent blood thinners such as Clexane and heparin very quickly, and even thrombolize these patients and do interventional radiology. Start blood thinners immediately if you know that the stroke is an infarct. If you know this is an infarct and not a bleed. And the only way you can comfortably know that is not by examination, but by investigation. In other words, a CT scan. And I want to use this medium to highlight that the government of Jamaica has a clear duty, and the rest of the Caribbean, and I'd say all governments of the world, have a duty to ensure that a CT scan is readily available within an hour to all members of its population, provided that no major catastrophe emergency is happening. So for instance, in Jamaica, we should have had at least a CT scan in every single parish or district hospital. So for instance, St. Anne's Bay should have a CT scan, Princess Margaret, Port Antonio. I can list them all out, but the point must be made that a CT scan must be available in every single parish hospital. That is a priority number one for all organs of government, to make sure that way we will save lives. Remember now, a CT scan is also vital for trauma. So not only will it help to reduce the stroke mortality by allowing us to know where there is an infarct so that we can give blood thinners, but for instance, to scan the brain if there's a blood clot from trauma or a motor vehicle accident, that the neurosurgeon can operate and can remove the blood clot, or if it's a relatively minor head injury, and the patient can therefore then be spared a trip into Kingston and can be safely monitored locally. So it is a vital emergency tool. And I would make an appeal using this audience to say that this must be a priority for any government that is in charge of healthcare in Jamaica. A CT scan in every parish hospital. It will absolutely improve the management of stroke. Blood vessel spasm. Sometimes from a hemorrhage, you can get the vessel going to spasm. In that case, you cannot give blood thinners. That's usually from a ruptured aneurysm. Where aneurysms rupture, you do not give blood thinners, but spasm of the blood vessels can occur, in which case you give antispasmodic medication such as nimodipine. 75% of strokes are what we call infarcts, and aspirin, heparin, and thrombolysis is what we give once we prove that there is no bleeding inside the brain. Sometimes there is massive swelling and you need to give a decompressive craniotomy. I cannot tell you how high the stakes are. This patient sadly died today, in fact, a few hours ago. She had multiple strokes and even had secondary seizures. And here it is what we're seeing. The patient has decorticate rigidity with the flex at the elbows, flex at the wrists, flex in the fingers, not communicative, and have to be fed by a tube into the stomach. This is not a pleasant way to live. And if you look very carefully, you'll see on the right-hand side here, a dressing being applied to a deep bed sore in the region of the greater trochanter, what's called a trochanteric ulcer. Sadly, this patient died today. Stroke begets stroke after multiple strokes. Let us try and prevent blood clots in blood vessels. Let us try to diagnose. Hemorrhagic strokes. No blood thinners are allowed. If there is bleeding in the brain, do not give blood thinners. What do blood thinners do? Thin the blood and promotes more bleeding. So if you already have bleeding inside the substance of the brain, which would be diagnosed on a CT scan typically, then giving blood thinners is akin to sending that patient into a greater degree of distress and worsening the condition. So that's why a CT scan is absolutely needed in every single parish hospital in Jamaica. And a CT scan is, you need at least 3 CT scans at KPH and at least 2 CT scans at Bustamante Children's Hospital. This is a basic tool of medicine. It is not a pie in the sky dream. It's a basic tool. And if the $14 billion were used instead of isolating COVID, we could have easily have gotten more than enough CT scans for every parish hospital. But perhaps the voice that said that we can't stop the spread of COVID was not listened to, but it is what it is. Ruptured blood vessel, so you have bleeding within the substance of the brain, that's a hemorrhage. We need the CT scan to tell us if there is bleeding. If there's bleeding, do not give blood thinners. See, bleeding, we need to know as well, because we can stop bleeding by operating or by sealing the blood vessel that's leaking on the inside. It's really important to know. And again, the CT scan, which by the way got the Nobel Prize, is a key element to managing stroke. A CT scan is fairly affordable for most patients in terms of cost. The problem is there's not a CT scan in every parish. Most CT scans are privately owned and operated. We need the government to step into this role and provide more CT scans right across the health sector. A subarachnoid bleed. This is a special type of stroke. This is where there's bleeding more around the surface of the, underneath the surface of the brain, underneath this brain, in what's called the basal cisterns, below the brain. This is a hell of a stroke, one of the worst of the stroke, the worst of the worst. It only accounts for about 5% or less of strokes, but accounts for 20% of stroke mortality. Once you've had a subarachnoid bleed, you're up against it. Only a 10% chance of going back to work. 40% die, 20% die on the spot. It is a horrendous condition. We must move heaven and earth to treat this condition. And President Joe Biden had 2 of these aneurysms clipped in 1989, and he's a survivor of the subarachnoid bleed. And one will say he does have a little bit of residual issues. As you know, the tendency is there when you listen to his speaking. But it's amazing that he's managed to live so long, and that is down to emergency brain surgery where we put a clip across the aneurysm. Nowadays, this type of stroke is 90% of them are sealed by putting platinum coils on the inside of the blood of the ruptured aneurysm. This is heralded by a massive headache, the worst headache in your entire life, worse than labor pain, worse than kidney colic, kidney stone. It is just a massive headache. Jamaicans, time and time again. I don't know, your Barbadian friends can tell us what they call it, but in Jamaica we say, boy, a duppy lick you. You feel like a duppy lick you at the back of your head. You don't know what hit you. You don't see no one, you don't see no sign of it, but all you feel is there's massive pain at the back of the head. And that's because the blood vessel that's ruptured is an artery, and it sends massive blood under high force under the surface of the brain and spews right to the back of the brain, right into the neck. And that causes horrible neck pain, horrible headache, and 20% die on the spot. Typically ruptured from an aneurysms. AV malformations can also cause this type of bleed. Do not give blood thinners. Do not give blood thinners if there's bleeding in the brain. Do not give blood thinners if there's bleeding in the brain. Do a CT scan immediately. Do a CT scan immediately to diagnose if this is an infarct or a bleed. This should be done within an hour, ideally within half an hour of the event. Now, I think that message is well taken by now, right? So we have 2 types, infarcts and bleeds. We need a CT scan to tell which one is which. And for the infarcts, we want to give blood thinners. For the bleeds, we want to not give blood thinners, but to seal the bleed, to stop the bleed and prevent the bleed from recurring as soon as possible. And that was my activism in Northeast London, to the immigrant section of London, where we had to wait 4 days, which is unbelievable. 4 days. If you had a subarachnoid bleed, you're waiting 4 days. Whereas in the posh side of West London, you are getting treated within 1 to 2 days. And we said that was not acceptable. So fortunately enough, we go to Newham, Stratford, East, for those who are familiar with East London. Then if you have a subarachnoid hemorrhage and you're taken to hospital, then you'll be treated within 1 to 2 days maximum. Moving on, causation, all strokes. This sort of pathological, these conditions underlie a lot of the strokes that we have, or most of the strokes. Diabetes mellitus, Jamaica's #1 killer, hands down. Nearly 3,000 Jamaicans die every year from diabetes mellitus. It is a killer. And one of the mechanisms by which it kills us is by causing a stroke. It also causes kidney failure, bad infections, blindness. It causes heart attacks. Diabetes is no joke. Hypertension, another killer. They call it the silent killer. The blood pressure is sky high, but you know not. Therefore, every household in Jamaica must have a digital blood pressure machine. And the best time to read your blood pressure is 6 a.m. in the morning and 6 p.m. in the afternoon. That's when your blood pressure tends to be naturally the highest. And that is the best gauge for your blood pressure. And it's better to take your blood pressure at home rather than at a doctor's office or at the hospital, because we know just a trip to the doctor can raise your blood pressure for various reasons. Healthcare is not cheap. And of course, you don't want bad news. Sometimes, unfortunately, the news is not too good. But take your blood pressure at home and you get a better reading. And 130 or less, the systolic pressure should not be above 130. And the diastolic blood pressure, the bottom one, should not be above 80. So ideally, your blood pressure should be like 127 to 180. That's the sort of blood pressure I want all of us, each and every one of us here to have. If not, then we need to lose weight, start to exercise, cut our salt intakes, cut our sugar intake, stop smoking, control our cholesterol, and let us reduce our blood pressure. But overweight is definitely linked with high blood pressure. Although not everyone who is overweight has high blood pressure, but we know there is a link there. Excess salt intake as well. High cholesterol, this can lead to stroke. Even if you do everything well, you don't smoke, you eat a vegetable diet, you exercise. Like, unfortunately, like my friend, a colleague who is now living in the States, he had a heart attack when he was exercising. Committed no sin in terms of he ate healthy, he didn't smoke, he didn't drink. All that was wrong with him was that he had an inherited hypercholesterolemia, and that unfortunately led to a heart attack, and he only has about 30% function of his heart. Another colleague of mine, sadly, who we buried last year, who had multiple heart attacks over 10 years, again, from familiar inherited hypercholesterolemia. So cholesterol, high cholesterol, 5.8 and above, that's a no-no. You have to be on statins, you have to lower cholesterol. Sometimes exercise is not enough. Sometimes you have to just take tablets. And a wonderful study was published recently. Statins cause a lot of problems. In fact, statins save lives. Approximately one life is saved every 40 out of every 40 or 50 who took the statins. And the side effects were overemphasized. In fact, after long-term being on statins, they are found to be very safe, be it atorvastatin, being Crestor, Lipitor, being rosuvastatin. These are widely available, and I think they are all covered. The top three are covered under the NHF. 1, 2, 3, diabetes, hypertension. To get those NHF cards filled out and get your benefit, whether you're 20 years old, 30-year-old, 40-year-old, 90-year-old. They all would be covered under the NHF, and a reduction in the cost of these very expensive medication, but they are life-saving medication. Smoking, unfortunately, this is not covered under the NHF in terms of things that are quitting from nicotine. But a community, we are in a community here. We must support our brothers and sisters who are battling the habit of smoking. Stop smoking is the best thing you can do for your health. Every study shows that, and smoking is a major cause of stroke, be it ruptured aneurysms, be it ruptured blood vessels in the head, be it blockage or occlusion or infarct. It also causes heart attack. So I know that this is somewhat of a sermon, but I'm not going to lie to you. I'm going to be honest with you. Smoking is really, really bad for your health. And 50 years ago, doctors were advocating smoking, good for the nerves, good for pregnancy and good for this and good for that. And it took a long time for doctors to accept that smoking is really bad for you. I, in fact, had a generational battle between my professors, my senior consultant, who had the habit of smoking, and I am a young doctor telling them to stop smoking, so you can see where the difficulty that I had in my career there. It wasn't well received at all, but unfortunately, they have died, unfortunately, from lung cancer or stroke. So I plead with you to desist from smoking. Obesity is, again, not everybody who is overweight is necessarily unfit, but it is linked with a lot of problems. It's linked with diabetes, it's linked with hypertension, it's linked with cholesterol, linked with stroke and heart attack. So losing weight and getting your body mass index below 27, ideally 25 or below is good, but of course not too low, not below 20, but certainly below 30. If your BMI is 35, you really should be doing something about it. Lack of exercise is also another no-no. Exercise is a wonderful thing. Exercise is as good as medication in combating depression. Exercise is as good as a lot of medication in controlling like mild and early diabetes, mild and early hypertension, and low levels of cholesterol rises. Exercise is a wonderful tool. And unfortunately, this was curtailed during COVID, but fortunately now the government has logged back onto the message, and they're now proponing and touting exercise. But exercise is a valuable tool, and I commend. And if we can do 30 minutes of exercise 3 times a day, no, 3 days a week, that is in fact a wonderful thing. Even 15 minutes of exercise a day, it's helpful. A wonderful, wonderful tool. And for those in committed relationships, then romantic exercise is also very good. Poor diet, too much refined starch, too much of it, too much salt, too much fat, too much starch. In fact, the very reason that we're brought here to till the soil and to plant sugarcane is actually now found to be bad for us. And today we saw a ruling where Kellogg's, unfortunately, they buck up into the High Court that now has a ruling on the matter that these frosted sugary flakes from Kellogg's should be banned, and they're banned from the UK and they should be banned from Jamaica. There's no place for these high sugary things in our, and in fact, you know that these sugars are associated not only with stroke, but they're also associated with cancer. It must never be the case that green veg are more expensive than cheap rice and wheat, than cheaper rice and wheat. So let us focus on really getting our policies correct, and let us get these impact labels on these highly sugary content, highly salt content, these high cholesterol, too much saturated fats. Let's get these labels on and let us get healthier. Stress. How can I tell you about this word, stress? Stress, what can I say? Everybody knows what stress is. And you see it, just walk the other way. That's all I can tell you. You see stress coming, walk the other way. It's an excessive emotional disturbance, prolonged, which may be visible or invisible. People bottle it in and say, oh yeah, man, we're not stressed, me all right, but deep down you're quite stressed. Talk to each other. Let us gather. Let's not forsake the gathering of our brothers and sisters, because within this we can bear each other's burden. High stress leads to high steroid levels, leads to diabetes, hypertension, obesity, cancer, low immunity, insomnia, all sorts of things that are bad for you. So see stress and leave it alone. If you lose your money, your house, you have your life, give thanks to God, because where there's life, there's hope. You have your health, give thanks to God. Don't take it for granted. Stress is just the reaction to things that go bad. Let us have a positive mindset. In in Ukraine, it's so ironic to see folks just getting on with their lives as if nothing's happened, because worrying is not going to help you. What does it help by worrying? What does it help? But only make us sicker. So let us not worry, but let us try and ease our burden. Guess what? Poor oral hygiene. We said a lot about this during COVID, but poor oral health leads to stroke and heart attack. Rotten teeth leads to COVID. It also leads to stroke and heart attack. So please get those dentures properly fitted. Let us clean our dentures. Let us get those bad teeth out. It's better we don't have them in than out. And let us make sure we visit our dentist or dental health center where possible at least twice a year. Let us do regimented oral hygiene. Floss, brush, Listerine at least 2-3 times a day. Regimented oral hygiene. And again, here smoking comes in. Smoking, of course, is a leading factor for poor oral health, as well as diabetes and hypertension. But it is in fact a vicious cycle that poor oral health can lead to stroke and other terrible conditions. I'm going to do about 4 slides here. What are the symptoms of stroke? Everybody must have some idea. Slurred speech. Person is become incomprehensible or slurred speech. Must be able to recognize that. And I'm not talking if somebody's drunk or inebriated or intoxicated. Weakness of the arm, leg weakness, twisted face, loss of sight, partial or complete loss of sight, maybe temporary or permanent. Neck pain, yes, with carotid stenosis or subarachnoid bleed. Headaches of all types, nausea, vomiting, drowsiness, seizures, loss of awareness, loss of memory, ringing in the ear, tinnitus, vertigo, you're spinning like a gig, blurred vision, subarachnoid bleed, thunderclap headache like the duppy lick you, mild headache, moderate headache, protracted headache. Remember, patients with brain bleeds will walk into the general practitioner's office. You will think, oh, it's not so serious, when in fact it's actually life-threatening. Do not take headaches lightly. If you have headaches that are out of out of the ordinary, not used to having headaches, and all of a sudden you're having headaches, and maybe a couple glasses of water doesn't help, because dehydration, we know, can lead to headaches. If after drinking a few cool glasses of water, the headache still persists, my friend, go and get it checked out. You may actually save your life. Incontinence, confusion. Headaches can be a sign of a bleeding blood vessel or a sign of a larger stroke to come. Please. Symptoms: paralysis, deafness, numbness, burning in a body part. These are some of the symptoms. Who to refer to neurosurgery with stroke? All strokes, all TIAs, all strokes. Best, all neurosurgeons should have vascular competence, because guess what we know about the brain? Refer all TIAs, transient ischemic attack. I see all strokes. Neurosurgery is, I would say, perhaps the most wide specialty in medicine. You have to know so many areas and to be fairly good at it, fairly decent at them. All carotid stenosis, no matter the degree, treat all stenosis 60% or higher. Carotid stenosis can be easily diagnosed with an ultrasound. Quick ultrasound of the neck can see the blockage. All strokes should have carotid ultrasounds. Treat all symptomatic stenosis where other causes can't be found. Investigations, you should be telling me this by now. A CAT scan, a computer axial tomography scan, a CT scan, the Nobel Prize winning scan, which needs to be in every parish hospital. A CT scan, emergency. This is an emergency tool. Get quickly, within 30 minutes, within an hour. We need to know if there is a bleed or an infarct, whether or not to give blood thinners or to withhold blood thinners. That is the question. And we need to answer this question no later than 3 hours. Because, for instance, if there is an infarct, we can give a drug called a thrombolytic drug that can completely melt away the blood clot. But we must not give that thrombolytic drug if 3 hours have passed with the stroke. This is an example of a CT scan of some other patient, of case we mentioned, who came in and the CT scan was said to be normal, but the person had symptoms. They had slurred speech and arm weakness. Even if the CT scan is normal, then you need to move on next to a CT angiogram and look at what the CT angiogram showed. Complete blockage, near complete blockage right here. You're seeing the cursor of the carotid, internal carotid artery on this side, on the left side. The right one was still okay, but look at the left one, completely blocked. Emergency. Here's the one that we saw recently as well. Look, bilateral blood blockages here. 1, 2, just like the pipes in our house, so do the pipes develop calcification and atherosmatous plaques in the blood vessels of our neck, and that can lead to stroke. And these type of stroke are preventable. They are reversible. We can do something about them. We can prevent massive strokes. If we once we diagnose and the occlusion is 60% or higher, you must have surgery. You must have stents. You must have something. Blood thinners are not going to be enough. You must open up the blood vessel and remove that plaque. You must remove that plaque. Carotid endarterectomy, which I do, used to be the most common operation performed in the States until we had the NASET study, which showed that we didn't need to do those if they're 50% or less. 50% or less, we can watch. We can watch those. Look at this lady who came in with a normal CT scan. Look what the MRI showed. Massive, massive area of brain infarction. MRI is more sensitive than the CT scan at diagnosing a stroke. MRI, excellent brain resolution, simply the best, but unfortunately it takes too long. And the government should ensure that within the public sector, we have an MRI scan at Cornwall Regional Hospital, an MRI scan either at Maypen or Mandeville Regional Hospital, and an MRI scanner at KPH and an MRI scanner at Bustamante. These are not pie in the sky. These are just basic tools that the government must provide for society. This example of the MRI shows narrowing right here, the stricture in the neck, blockage. So not all strokes are the tiny vessels. This stroke, if you watched CVM last week, Tuesday, you'd have seen me talk about the stroke, and you heard about a patient testifying that he had a blockage in the neck. Very narrow stenosis. I think everybody can see here the fairly horizontal line. That's a blockage, a fairly focal blockage right there in the neck. Ultrasound are beautiful. Here's an ultrasound that I did. I do portable ultrasounds. I carry my ultrasound around, and you can see here, unfortunately, somebody who was attempted strangling led to a blood clot in the neck, and you can see the blood clot here. You can see the color flow, the blood flowing around this blood clot, sticking out like perhaps like looks almost like the face of a rabbit or mouse or fish. But this is a blood clot in the wall of the blood vessel that should not be there. Easily diagnosed on duplex ultrasound. Strokes are emergencies. They are brain attack. And if you have a little bleed, a little stroke, it can be a sign for something big to come. Do not ramp with it. Don't joke with it. Act quickly. We know, just like heart attack, you must act quickly. You must act quickly. Duplex Doppler ultrasonal carotid, I can't praise this enough. CT angiogram is ideal when you want to see the balance of urgency, something that's quick and it can quickly diagnose stenosis. MRI scan is highly sensitive. Digital subtraction angiogram, taxa angiography is where you're actually doing interventional study. You're going to do something interventional. Either you're going to unblock it with a stent, or you're going to thrombolize, or you're going to put coils in to see the bleeding. Here is an example of a carotid endarterectomy where we prepare to unblock the big carotid artery in the neck. The brain gets 20% of every time the heart pumps, 20% goes to the brain. If it's blocked, is a massive problem. Here it is that we see the common carotid artery dividing into the internal carotid, external carotid, and the internal carotid artery. And right here where the cursor is, we're seeing evidence of a plaque. When we open it, here it is, an on-table angiogram is done, and you can see the blockage right here. You can see the blockage in the internal carotid artery. That's a no-no. So we proceed to surgery. At surgery, you can see again here, you know, speed this up a little bit, speed this up a little bit, speed this up a little bit, turn the right way around, and you see the block right here. On-table angiography, we pioneered this. The first time it was done at Medical Associates, we pioneered that for them. Right, unfortunately, no longer have a C-arm at Medical. So here it is now. We open the same blood vessel and look what we're finding. You tell me if this does not look like cooking oil. That's kind of congealed. This is exactly what happened. The same extra saturated fats that you eat too much of, be it the KFC, the Wendy, the Burger King, the Popeyes. I don't want to single out any. I want to pick all of them in these fast foods, high saturated fats. You have to be careful of them. Everybody must know their cholesterol. Everybody must know their blood pressure. Everybody must know their sugar levels. Everybody must know their weight. This is not the time. We got 3 very loud warnings. One from Chick-fil-A, one from Zig-V, and now the loudest of all warnings, one from COVID. People who have diabetes, obesity, hypertension, that's not controlled, that's not diagnosed, those are the folks that do the worst in COVID. You cannot have this building up in your neck and you don't know. You cannot have it. You have to know. This is not the time where we don't know. So we take out this plaque, and inside this plaque, you will see that little reddish appearance. When we cut it open, there you go, boom, a blood clot, blockage right inside the plaque. The plaque fissured, thrombosed, cracked, fractured, and boom, a blood clot formed and completely cutting off, leading to this type of pattern, courtesy of Dr. Jennifer Mambi Alexander, one of the leading pathologists in Jamaica, cutting edge lady. Here it is, quite blockage, massive blockage, massive blockage, massive blockage. We don't want that to happen at all. This is afterwards. Remember that little narrowing that we saw first? And here it is now. All right, we can remember this picture. Here it is. Look at this picture. Look at it now at the end on the table. We do the CT angiogram at the Art of Surgery now. You can see this in Ripon Road. We do this for you. Art of Surgery, excellent C-arm, visualization, subtraction capabilities right there. A small bespoke hospital. We give a patch. Here it is that we stitch. You know, thank God for your mothers and grandmothers who taught you how to sew. Here it is. We stitch the plaque in, stitch the plaque on the microscopic vision. That's my thing. And we get good. So we must think fast. When you have a stroke, think fast. F-A-S-T. What's the word? Fast. Fast. Think fast. Quickly. But fast stands for, is an acronym for F, face, twisting of the face, A for the arm, S for the speech, and T for time. Less than 3 hours. We must get this wrapped up, diagnosed within 3 hours. Within 30 minutes, you should have a CT scan. Face, arm, speech, time. Rush them to the emergency department. Do not mess around with a stroke. A stroke is like a heart attack. In fact, we call a stroke a brain attack. Do not mess around. A stroke must be treated with urgency. Early treatment matters, not only for COVID, where the argument was sealed, done, and we've completed the argument. Early treatment matters in almost every aspect of medicine, and more so stroke and heart attack. Early treatment matters. If you're not sure you're having a stroke, go book an appointment, invest in your health, get a comprehensive consultation, get a comprehensive evaluation to look at your stroke risk assessment. And that can easily be done by neurological surgeons. I'm suppose cardiologists, physicians can also do that. But I do that day in, day out. That's what I do. To risk assess patients who had stroke and to prevent the stroke. We don't want no more stroke because we can't return brain cells. So we are laying down the charts, government here. Get a CT scan in every single parish hospital. And that won't cost billions of dollars. In fact, I doubt it will cost $1 billion. Get CT scanned in every parish hospital at Sablamar, at Lucy, Noel Holmes, etc., Falmouth, etc., etc. This will save lives. Not only good for stroke, but also good for trauma. Also good for cancer. Very important for those, the least among us who can't afford it. So what must every home have? Every home must have a blood pressure machine. Check your blood pressure twice a day if possible. 6 a.m., 6 p.m., or at least once a day. And your blood pressure should not be more than 130/80, no higher. Check your blood glucose level. Your fasting level in the morning should be 3.5 to 5.5. Your HbA1c level, that gives you an idea of control over the past 2 months, should be no more, should be between 4 and 5.5 range. HbA1c of 6 and more, you're begging for trouble. You're looking for problems with blindness that will lead to problems with stroke and heart attack. Get your A1C level correct, in good order. A digital scale, your BMI should be less than 30. Your body mass index, 20 to 30, 25 ideally, don't get it more. Get your BMI in good order. You mustn't be too thin, but certainly if your BMI is more than 30, you need to start to work out. Unfortunately, due to violence, you might not be able to go outside and work out. Just walk out at the bedside. Do deep breathing exercise. Do leg lifts. Do push-ups if you are able to. Do deep breathing. Do leg lift. Do get on your tummy. Do reverse back arches. Day in, day out. For those societies where there's snow and you can't go outside, you can do exercises right at your bedside. 15 minutes can save your life. Normal readings, 98 degrees in temperature. Everyone must have a thermometer. High temperatures can lead to stroke. Heat strokes are real. Oxygen saturation. By now, you have heard the argument about O2 sat, and we're happy to have brought that argument to society, where every home must have a pulse oximeter. Costs anywhere from $3,000 to $5,000. You can get them at a nearby pharmacist or online at Amazon, eBay, online, or get someone to get for you. But the pulse oximeter measure your oxygen levels, and SpO2 should be 95 to 100%, right? Regardless of your age, you should not be down at below 90. No. I saw a young lady, a young mother last week, her oxygen saturation was down in 84%. She didn't come to me, she brought her son to me. And when I saw her oxygen saturation at 84%, I wondered why. I listened to her heart, and lo and behold, she had a huge humongous murmur. So it clearly suggests that she had an undiagnosed murmur, hole in the heart with mixing of arterial and venous blood leading to a reduced saturation. Immediately, I sent her off for cardiological evaluation. A pulse oximeter is a life-saving tool, a very important tool. It's relatively affordable. It should be in every home. Again, your blood pressure machine, your glucometer machine, your digital scale, your thermometer, your non-contactless thermometer, and your pulse oximeter. Cholesterol requires blood taken twice a year. It should be off and get your blood test. You can do it if you're yearly executive or twice yearly. Your cholesterol level should be somewhere between, say, between 4 and 5.5. Certainly not more than, should be less than 6. Infarct versus a bleed. Bleed, immediate neurosurgery consult. Infarct, immediate neurovascular consult. 2 aspirins if there's a blockage. 2 aspirins right away. Heparinize, thrombolize. Get neurosurgery standby. These are at the hospital level. This is after a CT scan is done. If there's carotid, you scan the carotid as well. Make sure the carotid arteries in the neck are also scanned. Ask the doctor, did you scan the carotid artery? Did you scan the carotid artery? Not only the cerebral arteries, did you scan the neck? This is the plaque? How much does it look like KFC to you? Look quite fatty. That's literally what was removed from inside the blood vessel. Guess what you can do? Once you've had a stroke, you can prevent a second stroke by your diet, by your exercise, stop smoking, stress control, get your health checked, invest in your health. Do not treat your health as a Cinderella. Yes, I know health costs are high, but prevention is better. Prevention is always better. You buy a new car, you get it, nothing is wrong with the car, you have to get it checked every 3 months. Much more, how much more so should you not also get your bodies checked? Not because you're 90, so can't bother with that. No, we can live. I think that we're not living to our actual true potentials, that we should be living easily to 150 years old. That's my view. Perhaps I'll be contradicted, etc. But we really are not living to our true potential. I think that we're dying too early. That's my view. But if primary prevention fails, early intervention is best. Call neurosurgery immediately. Surgery experience is more important for outcomes. Don't be afraid to inquire. And independent investigation specialist institutions, outcomes, all of these are important. To ask the question, if you had a stroke, something go wrong with you, you're better now, but something was wrong. Ask the question, why was I confused? Why was I not speaking? I'm recovered now. Why? Get a neurovascular consult. And if you're not sure if you have cardiovascular, cerebral health, your cerebral health, your carotid health, your cerebral health, you can also get a neurovascular consult. The life you save may well be yours. Act fast. Face, arm, speech, time. Act fast, my brothers. Act fast. CT scan immediately. I hope the government is listening. This is a blood clot blocking the vessel. Please let us not wait for this to happen and then we have an acute emergency. Here's a nurse, saw her recently. She's still alive. We managed to prevent her clot for getting secondary stroke. And this is 8 years ago. And here she is still going strong. We are so pleased that this is the case. Ladies and gentlemen, here I rest. I have so much more I could say to you, but for the interest of time and questions, I will yield at the moment and I'll stop sharing my screen. Thank you very much for listening.
Thank you very much. Thank you very much, Dr. Hunter. Wow. I think what I like to say to the persons online, because it was so much to absorb, that we are quite happy to make the video available. I can tell you, it will be up in about another day or two, and you can all go to our YouTube channel. It's called KCOK for Kiwanis Club of Kingston. That's the KCOK YouTube channel. And you will be able to find this. So what you couldn't keep up with, because there really has been a lot of information. I need to watch it again. So we're gonna allow for a few questions. We're obviously
DP Stewart?
Yes.
Let me just apologize for the absence of President Paul. He had to leave and he has just asked me to sit in for him.
Sorry, let us tell him why though. For those who do not know, President Paul has been seconded. He works with the foreign ministry and he has been seconded, I mean, not seconded, assigned to Japan. So he's really been conducting our meetings from Japan. And 7 p.m. in Jamaica is 9 a.m. in Japan. So he's at work. So he had a meeting that he couldn't skip. So he had to leave during the presentation.
Right.
Continue.
Yeah, hold on. Yeah, right. I just want somebody to move a motion for an extension of 15 minutes for this meeting. May I have someone moving the motion?
I so moved.
So moved.
Seconded.
Second by Stanley Dunwell.
All right. There's no objection. The motion carries. So
yes.
at this time, thank you very much, Dr. Hunter, for your presentation. We are the wiser for your presentation, and I hope that we'll all be so more health conscious. We can take care of our health. DP Stewart, I think maybe we could ask about four or five questions or so in the meantime.
Yes, at most.
All right, can we do that? Maybe see. There's a question that was in the chat some time ago by Robert. I'm not sure I really understand the question, but perhaps Doctor will better understand it. Can someone with a broken instrument from a dental safely get a C scan?
Yes, absolutely. Yes.
Oh, okay, okay.
What the person was asking is really, can they safely get an MRI scan? So the question is, depends on what that, the MRI is magnetic, right? So if it's a ferromagnetic instrument, stainless steel, no. But if it's a titanium instrument, yes. So if it's a non-ferromagnetic, yes, it can safely get an MRI scan. So that's what the person was really asking. Can they safely get an MRI scan? But you can safely get a CT scan. The problem with metal though is that even with a CT scan, the metal may actually cast a shadow, but you can do what something that's called windowing, and you can still see, even though the metal is there, you can window, change the densities, and you can still see beyond the shadow of the metal. So yes, absolutely 100% can safely get a CT scan.
Thank you, thank you. I recognize DLG Joe. DLG, can you go ahead with your question?
Yes, I'd just like to ask Dr. Hunter, what's the relation between...
You know, Dr. Hunter.
Hello?
Go ahead, DLG. Go ahead. Go ahead.
What's the relation between a heart attack and a stroke? And can you get a stroke without your heart being affected?
Vice versa. I have a very close relationship. Thanks for that excellent question. So my talk today could easily be on heart attacks as well, except that typically in heart attack, you don't get bleeds into the heart. You just get blockages. The blood vessels don't tend to bleed. But it's really an abnormality of the blood vessel. That's why they call it cardiovascular disease, blood vessel disease. But there's a very close relationship, because if you have damaged blood vessels in the brain, chances are you have damaged blood vessels elsewhere, including inside the heart, in your kidneys, on other areas, in your feet. Especially consider if you're a smoker. Smokers don't only have a risk of heart attack, they also have a risk of stroke, and also have a risk of losing their legs. Diabetics as well. They get strokes, hypertension, they get strokes, they get heart attacks, and they get, because of the blood vessels. It's really a commentary on the state of your blood vessels everywhere they are, whether they are in your brain, or in your heart, or in your kidneys, or in your legs. So there's a very close relationship. So the fact that you got a stroke suggests to me that you're clearly at an increased risk of a heart attack as well. So you have to look at what are the factors that led to the stroke. If, for instance, you had smoking, you have high cholesterol, and diabetes is not controlled, hypertension. So there is a very comprehensive and clear-cut relationship between heart attack. Because when the heart gets badly damaged, it tends to fibrillate effectively.
All right, sorry, please.
Sorry. May I ask DP Stewart, can you mute that person? Can you mute that person for me, please?
But let us ask everybody to keep your mics on mute unless you are about to speak and you have been so I'm gonna look for that person.
Yes. Can you mute? Yeah, go ahead, Dr. Hunter.
Okay, we got a question now. So if you've had a stroke, one of the complications of stroke is a heart attack, because some types of strokes, particularly subarachnoid bleeds or hemorrhagic stroke, they lead to a massive release of adrenaline and noradrenaline, and these things stress the heart and can easily lead to heart attack. So not uncommon. We see people who have a stroke end up with a heart attack. What about the reverse? When you have a heart attack, the heart is not pumping blood effectively. So you have less effective circulation of blood to the brain. And if the blood pressure is low and the circulation to the brain is reduced significantly, certainly if your blood pressure drops below 90 systolic, that can lead to a stroke. So there's a very close relationship, both in terms of causation of the stroke or causation of the heart attack, as well as the effects of the heart attack on the heart, on the brain, and effects of the stroke on the heart. They're very closely linked. Neurocardiogenic effects.
Thank you very much, Doctor.
Right. I recognize now President Audrey. President Audrey.
Yes. Thank
you.
You
Of the Garden Parish, yes?
Yes. Good evening, everyone. Doctor, let me commend you on a very comprehensive and, comprehensive explanation of this whole stroke problem. I'm still trying, though, to figure out the correlation between a clot in the brain and stroke? Is it because the heart is not pumping the blood enough? Is it a circulation issue if the person gets a clot in the brain during a stroke?
Okay, so the brain has blood vessels. Thanks for that question. The brain cells, by and large, called the neurons, they need nutrition, they need oxygen, they need glucose. What takes that to them is called blood vessels, arteries. When I say a clot in the brain, I'm thinking particularly a clot in the artery itself. As you saw on my slide, that those red dots, you saw that plug, that high fat, that's blocking the artery. When the artery can't, when the flow through the artery is blocked, then everything beyond the flow will dry up. They won't get their oxygen, they won't get their glucose, and they will die. That's what happens with a stroke. Or if, for instance, the pipe bursts, releasing blood elsewhere and reducing effective circulation, cutting off the circulation to where it should go. So a clot in the brain needs to be qualified. What do we mean by a blood clot in the brain? It has various meanings. In respect to stroke, we're talking about a blood clot inside the vessel itself, blocking flow to brain cells. You can also have an unusual type of blood clot that occurs in the veins of the brain, and that can result in stagnation. As you know, the veins take blood away from the organ, and in this case, veins take blood away from the brain. If there is a blood clot in the venous sinuses of the brain, the veins of the brain, that can also lead to a venous infarct of the brain. So it's really about the circulation of blood to and from the brain. That's what we're talking about, blood clots, with respect to stroke, a blockage, an interruption of the blood supply to and from the brain cells, leading to permanent dysfunction or temporary dysfunction of the brain cells.
Okay.
This is different from somebody hits you on the side of the head and you have a ruptured artery that get a blood clot inside the head, and that bleeding, there's bleeding in the head from a trauma, and that is which is diagnosed on a CT scan like epidural. That is a different type. That's a different thing altogether. That's traumatic hemorrhage, and that's not really a stroke per se. Although if it's not relieved, it can cause secondary stroke. But that's a blood clot outside the brain, pressing on the brain, or even within the brain that's pressing. But that's traumatic. That's trauma. Different ball game altogether. But if you are here sitting here and you suddenly pass out like that, that's a blood clot in the carotid or inside the head. There's blood, no longer circulating to my brainstem or to my diencephalon, my thalamus, and I pass out and I could die.
Thank you, Dr. Hunter. Well, we have two more questions. Let me recognize Shauna K. Williams, one of our, Shauna K. I see you posted something in the chat. Can you ask your question, please?
Oh, no, I wasn't asking. I was sharing based on a question I think someone by the name Robert had, if a stroke can affect the heart. So I was just sharing that my mom had that experience where the cells were damaged in her brain, and of course the ripple effect resulted in a damaged heart. So I wasn't asking a question, but connecting with the question.
Thank you. Well, we have one more. We have room for one more question.
Can I just say something before the question comes in?
Sure.
For those who are biblical, be careful what you feed into your brain. What goes in your brain can cause you to drop dead, literally. And we saw that with COVID. If I told you you had COVID, it could cause you to drop dead. And you remember Ananias and Sapphira in the Bible. Some bad news came that her husband had died, and straightway she lost the ghost and dropped dead. If I tell you something that your house burn up and everybody in there burn up and chop to pieces, that can cause your brain to react in a certain way and literally stop your heart from fright, from shock. So there's a very close, intimate relationship between the brain and the heart. They are extremely closely related. One affects the other, vice versa, every time.
Thank you. Thank you so much, Dr. Hunter. If there's no other question, then we can move to the vote of thanks. And
can I just emphasize, as we are in summer, you can get a stroke just because you have become dehydrated, because you're losing a lot more water. So I am emphasizing that we must drink extra. Avoid being thirsty. Even if you're not thirsty, drink something. And I know in the night you don't want to drink too much because you don't want to get up and break up your sleep. But certainly through the day, you want to drink extra because it's become very hot. Thick blood clots. So blood becomes concentrated because it's lost water. That forms a clot inside the blood vessel, and that can lead to a stroke. So I want to emphasize here on this platform to drink extra, hydrate, and keep cool. Thank you.
Thank you so much. At this time, good evening.
I am driving, but sorry, good afternoon. Good evening. I have been listening to you, Doc, and I must say thank you also for a very clear and concise presentation. I have been diagnosed with high cholesterol in recent times. I am not sure why this is happening. I don't eat the Burger Kings and the Kentucky and those stuff. I don't eat like that. I eat pretty much like a vegetarian. I exercise. I am hypertensive, though, and I have had 2 tests done, and I am diagnosed with high cholesterol. I am honestly frightened by your presentation. I'm driving and saying, oh my goodness. However, I am not so sure what to do. I honestly am not sure. I also have an injury to my spine. I had an accident, and I am not sure, but I'm diagnosed from musculoskeletal, not the other one. I am diagnosed that I have a sepsis. So I'm also suffering from cramps in my legs and pain in my back when I stand too long. And now this situation with high cholesterol, so I am not so sure.
Could I ask you how high is your cholesterol? Just quickly, just say roughly what numbers.
I am not so sure I remember clearly, Doc, but
7, 8, 9, 10.
The first, no, it was about 7.
Yeah, okay. All right, let me answer your question. Chances are you unfortunately have what's called familial hypercholesterolemia. You have a gene where your body is making excess cholesterol. Half the body has the ability to make cholesterol. You're like Arthur Ashe. You have familial hypercholesterolemia. You exercise, you eat healthy, but yet your body still makes cholesterol. You have a inherited condition. You must be on cholesterol lowering drugs. There is no 2 ways about it. And in fact, exercise may precipitate a heart attack in you. So the first things first, you must control your cholesterol levels with tablets. So I recommend strongly you go to an internal medicine physician. You can come to myself, but I am not the primary person for cholesterol. I would suggest that you go to a physician internist. If you're not getting through, you can Google my name and you can come to my office, but you must get that cholesterol under control. You should also get angiographic studies, probably of your heart and of your brain as well, to make sure there's no occlusion there, because that could be that you're on your way to getting a stroke or a heart attack. I have found that people with high cholesterol tend to have aches and pains all over, and I attributed that to circulation problem and sludging. So you must be on cholesterol lowering drugs. Exercise and diet alone will not save you in this condition. Go and get tested with your general practitioner. Let them spend at least an hour with you, going through comprehensively. Check your family history. Maybe your mom, your aunt, your cousins had it. Maybe they died history of dying young from heart attack. But familial hypercholesterolemia is no joke. And as I said, we buried our 50-year-old colleague who is a doctor last year, from familial hypercholesterolemia. And we have another colleague who unfortunately had to migrate to the States because he only has 30% heart function left. So familial hypercholesterolemia is no joke. that you don't smoke, you don't drink, you don't do anything wrong. Only thing that you have an inherited tendency for high cholesterol. You must control it. There is no doubt about it. And once you control it, then you can look forward to a long, healthier life.
Thank you, doctor. We only have one last question. I know there are persons who want to ask so many, but in the interest of time, we can only allow one last question. Glendery James, actually, Glendery, are you here? If I'm pronouncing your name correctly.
Yes,
Yeah.
you're pronouncing my name correctly. Thank you very much. Dr. Hunter, good evening. Quickly.
Good evening.
I was going through a very stressful time about 3 weeks ago. And I, just by listening to you, I realized that I have become concerned. I was having some terrible pains in my neck, something I've never felt before. And in my shoulder. However, I did arthroscopy surgery on my shoulder, and I am not sure if it has anything to do with maybe a stroke or anything, but I am concerned. So I'm asking the question, is it too late for me to check that out to see if it had anything with me getting a stroke, or it should have been done when I was having the problem?
Unfortunately, sometimes medicine is kind of in little pockets. So you have a shoulder problem, we only look at the shoulder. No, it's not too late. I recommend that you get a more integrative, comprehensive review evaluation, 1 hour, to evaluate not just the shoulder, but the whole thing. Remember, pain in the shoulder can emanate from the neck, can emanate from the brain. So you need a comprehensive evaluation and from their investigation. It is not too late. I urge you to get looked out, to get investigated. Heart attack can cause pain in the shoulder area, for instance. So many reasons beyond just the arthroscopy. So it's important to get a comprehensive view of the whole situation. Sometimes it's just tension, sometimes it's scarring left over from surgery, a lot of multiple problems. But it is not too late. I'm glad you brought it up. Please go and get looked at, evaluated comprehensively.
Thank you so much, Dr. Hunter. And let me apologize for those who didn't get a chance to ask the questions. But at this time, I will ask Chairman Dr. Andrew Burton to do the vote of thanks. Dr. Burton.
Hi, good evening. My apologies for no video because of the time I had found myself mobile. No, but I want to express gratitude, sincere gratitude to Dr. Hunter. That was a very, very good presentation. I think the people in the chat have really used a lot of the adjectives that are applicable. It was informative, it was excellent, valuable, and we definitely appreciate it. I think you had a lot of information that not only applied to the general public, but also that even went a scientific appetite and even gave good medical advice to those of us in the field about, who to refer and what to look for, what kind of scans to do, and the importance of timing and appropriate use of medications. I think it was also very important that you highlighted all the things that we can do to modify our risk for strokes, exercise, controlling diet, stopping smoking, even hydrating well. And I think the information was well received. So thank you so much for taking the time out to share with us.
My pleasure. You're welcome. If I prevent one stroke from this presentation, then my job has been done. Thank you for having me.
Thank you. Thank you, Dr. Hunter. Our SAJ is not available this evening, but we will just have a blanket fine to all the members of the Kiwanis Club of Kingston, $200. So that is the fine, fellow Kiwanians. And Dr. Hunter, there is the certificate of appreciation. Can you read it for us, DP Stewart?
Okay. It says Kiwanis Club of Kingston Certificate of Appreciation presented to Dr. Roger Hunter in recognition of your contribution to the Kiwanis Club of Kingston, given this 5th day of July 2022, with pleasure, and it's signed by our President Paul Peart and our Secretary William Reese. And we know Dr. Hunter has one of these already, at least one or two, but we're so appreciative when you come to talk to us. So thank you again.
My pleasure.
I have to present something different next time, DP Stewart, right?
Yes.
All right. DLG Willie, we're at the point of notices and announcements, interclubbing opportunities. Over to you, DLG Willie.
Thank you, LGED Desmond. In the interest of time, I just want to quickly run through some notice and announcements. Members of the fundraising committee, tomorrow evening, we have a meeting at 6 o'clock at the home of Pastor Director Garfield Wynn. Begins at 6 o'clock. DLGE Stan and myself want to meet with President Desmond Jr. for half an hour just at 5:30 at the same venue. This meeting tomorrow night is crucial because it's a planning meeting for our next fundraiser, which is going to be the benefit performance of the National Dance Theatre Movement on Saturday, July the 30th at 8 o'clock. So far as other announcements, the Kiwanis Foundation of Jamaica's annual general meeting is to be held on Sunday, July 24th. Last night at a board meeting, Pastor Trustee Ronson Eunice was appointed as the official delegate for the club. A reminder of the All Island Convention being held at Grand Bahia Hotel between July 29th and August 1st. On Sunday, July the 31st, in fact, is the one-day All Island Convention. We have so far a number of people who have registered, and hopefully we can go down as a team. And lastly, with respect to District Convention, this has been held in Fredericton, New Brunswick. I understand it's going to be a hybrid meeting, and has been held between August the 18th to the 20th. So far as in the clubbing opportunities, I will inform the club, members of the club. Tomorrow, I'll send out a WhatsApp, inform them of the club opportunities for the rest of this week.
Thank you.
LGED, you may ask any member of visiting clubs if they have an announcement.
May we ask the visiting clubs just to make your announcements at this time? Visiting clubs?
Okay, good evening, everyone. President Audrey from Kiwanis Clover Garden Parish. I don't know if we're all aware that DLGE Eva has passed. Yes, she passed 2 weeks ago, and she'll be cremated, but the funeral will be all the way in November. That's according to her daughter. However, something is being planned so that, Kiwanians may come and, celebrate her life by her place of business. And so further details will be, disseminated closer to that time. So, so that information will be disseminated to the different clubs.
Thank you, President Audrey. Before I take the other announcement, let me recognize DP Earl. Do you have an announcement?
Not really an announcement, but I'm just thinking how the presentation by Dr. Hunter reminded me of something I heard. And it was that this person who was probably my age or a little older was told by the doctor, given a certain prescription. And then the doctor saw him out with a hot mama. And he said, "What you doing?" He said, "I thought you said I must get a hot mama." And the doctor said, "No, I say you have a hot murmur." So we have to be careful that the elder ones actually hear what the doctor recommends. I just thought I'd share that.
Thank you, sir. Thank you, sir. I see you really have replaced our Sarge with that joke, so we appreciate it. Thank you.
All right.
All right. The thought for the week. Thank you, DP Earl. Thought for the week, DP Stewart.
Okay, thank you, Acting President. I have two thoughts as usual. The first one, it is easier to go from failure to success than to go from excuses to success. And that's a quote from John Maxwell. And the other one is, isn't it funny that it's oftentimes the people that no one imagines anything of that end up doing things that no one can imagine? And those are my two thoughts.
Thank you,
Thank
sir.
you. Yes. you're
Thank
welcome.
you as usual, DP Stewart. Always appreciate them. I see persons really want to ask questions, but after the termination of the meeting, if Dr. Hunter will be available and persons still want to ask, if that is allowed, then we could go there, but we'd want to terminate the meeting shortly. So at this time, may I ask fellow Kiwanians, may we raise our real or imaginary glass to a toast to Kiwanis International, Jamaica, land we love.
Jamaica,
and I know some other Kiwanians say, and a friendly Jamaica. All right, but Kiwanis Club of Kingston say, toast to Kiwanis International, Jamaica, land we love. Thank you very much. We appreciate your being here. We appreciate all the questions that you have asked. And of course, to Dr. Hunter again, sir, thank you very much for being with us and educating us. We can be more health conscious. So this meeting of the Kiwanis Club of Kingston is now terminated. Thanks, everyone.
And if, just as you said, if you want to ask, I'm not sure if Dr. Hunter is still on, but if he is, he may be willing to engage.
Yeah, DP Stewart.
Yes, President. Yes, DLG Willie.
You had over 200 participants this evening.
Yeah, I was keeping track.
Total 217 in fact, up the highest.
Yes, okay. Yes.
216 in fact, sorry, 216.
Yeah. Okay, well, if no other questions, DP Stewart, you are the DJ.